Look down at your feet right now. Go ahead, actually do it. Because what you're about to learn in the next few minutes is going to completely change the way you see those two things at the bottom of your body that you've probably been ignoring your entire life. Most people think about their heart when they think about their health. They think about their weight, their blood pressure, maybe their cholesterol, but almost nobody thinks about their feet and legs. And that is one of the most dangerous oversights a person can make, because your feet and legs are not just transportation. They are not just the things that carry you from the couch to the kitchen. They are, according to some of the most compelling research in modern medicine, one of the most accurate and early warning systems your body possesses. They are quietly, constantly broadcasting signals about what is happening deep inside your cardiovascular system, your nervous system, your metabolic health, and your biological age. And most people are receiving those signals every single day without having any idea what they mean. Here is the terrifying part. Many of the conditions that kill people, heart disease, diabetes, arterial disease, neurological decline, don't announce themselves loudly at first. They whisper, and they whisper through your feet and legs long before they ever show up on a standard blood test or a routine checkup. But before we go any further into what those whispers sound like and what they mean, I need you to hold on to something. Because in about 60 seconds, we're going to talk about a specific sign that appears in the legs of people who are at the highest risk of a cardiovascular event in the next 5 years. It's a sign so subtle that most people dismiss it as nothing, a sign so ordinary looking that doctors sometimes miss it in brief appointments. And when you hear what it is, you're going to want to check yourself immediately. Keep watching, because that sign is coming, and it might be the most important thing you learn today. Now let's start from the beginning, because to understand why your feet and legs are such powerful indicators of your overall health, you need to understand something fundamental about how your circulatory system works. Your heart pumps blood outward through your arteries to every part of your body, but pumping blood all the way down to your feet, the furthest point from your heart, and then getting it back up again against gravity through your veins is one of the most demanding tasks your cardiovascular system performs. It requires healthy, elastic, unobstructed arteries. It requires functioning valves in your veins. It requires a nervous system that is communicating clearly with every blood vessel and every muscle in your legs. And it requires adequate blood viscosity, healthy red blood cells, and a body that isn't in a state of chronic inflammation. When any of these systems begins to fail, and they often fail slowly over years before any crisis occurs, the feet and legs are frequently the first place the evidence appears. Think about it geographically. If there is a blockage or narrowing in an artery, the tissues furthest from the heart suffer first. If there is nerve damage, a common consequence of diabetes and other metabolic conditions, the nerves at the ends of the longest nerve pathways, which happen to be in your feet, are the first to show symptoms. If your venous valves are weakening and blood is pooling rather than returning efficiently to the heart, your ankles and lower legs bear the evidence of that failure first. Your feet and legs are, in the most literal anatomical sense, the canary in the coal mine of your body. They are downstream from everything, and downstream is always where the problems show up first. So let's talk about the signs. Let's talk about what your feet and legs might be telling you right now that you haven't been listening to. And let's be specific, because vague health warnings are useless. What you need are concrete, recognizable things to look for and feel for and pay attention to. The first sign is one that almost every adult over 40 has experienced at some point and almost universally dismissed as nothing more than an annoyance. It's cold feet. Not metaphorical cold feet, literally physically cold feet. Feet that feel significantly colder than the rest of your body, particularly in temperatures that shouldn't be causing that kind of chill. Most people assume this is just a circulation quirk, something genetic, something that a thicker pair of socks can solve. But persistent cold feet, especially when one foot is noticeably colder than the other, can be a direct indicator of peripheral arterial disease, one of the most underdiagnosed and underappreciated cardiovascular conditions affecting adults worldwide. Peripheral arterial disease, or PAD, occurs when the arteries that supply blood to your legs and feet become narrowed or blocked by the same process of atherosclerosis, plaque buildup, that causes heart attacks and strokes. In fact, people with PAD are at a dramatically elevated risk of both. The connection is direct and well established. The plaque isn't just in your legs. It's a systemic process happening in arteries throughout your body. including the coronary arteries that feed your heart and the carotid arteries that feed your brain. So when your feet are telling you that their blood supply is compromised, what they're really telling you is that your entire arterial system may be under threat. What makes PAD particularly insidious is how quietly it progresses. In its early stages, many people have no symptoms at all. Then come symptoms so easy to dismiss: cold feet, mild fatigue in the legs when walking, a vague heaviness or achiness in the calves that goes away with rest. These are not dramatic symptoms. They don't send people rushing to emergency rooms. They get attributed to aging, to being out of shape, to standing too long, and meanwhile the arterial narrowing continues. The plaque continues to build, and the risk continues to climb. Now here's the sign I promised you, the one that appears in people at the highest risk of a cardiovascular event in the next 5 years, and the one that is so commonly overlooked it is almost criminal. It's a specific kind of pain in the legs that appears during walking and disappears, reliably, consistently, within a few minutes of rest. It doesn't sound alarming. It sounds like being out of shape. It sounds like normal aging muscle fatigue. But when this pattern of pain, appearing with exertion, vanishing with rest, appearing again with exertion, happens in the calves, thighs, or buttocks, it has a clinical name: intermittent claudication. And it is a hallmark symptom of significant peripheral arterial disease. The pain is real and it is logical. Your muscles are demanding more blood flow than your narrowed arteries can deliver. When you rest, the demand drops and the pain subsides. But the narrowing hasn't gone anywhere. The risk hasn't gone anywhere. And every time that pain appears and disappears without you seeking answers, time is passing. If you've experienced this, and if you've noticed that your legs feel noticeably heavy or painful when you walk a certain distance and then feel better when you stop, please take that seriously. Please have a conversation with your doctor and ask specifically about peripheral arterial disease. There is a simple non-invasive test called the ankle brachial index, essentially a comparison of blood pressure in your ankle versus your arm, that can detect PAD quickly and easily. It costs almost nothing. It takes minutes, and the information it provides could genuinely be life-saving. But let's continue, because there are more signs, different signs, that point to different systems, and some of them are even more visually obvious and even more commonly ignored. Swelling in the feet and ankles is one of the most physically visible warning signs your body can produce, and yet the vast majority of people who experience it regularly treat it as a nuisance rather than a message. They elevate their feet for a while, maybe take an over-the-counter water pill, and move on. But chronic, unexplained swelling in the lower extremities, particularly swelling that pits when you press it with your finger and leaves an indentation that slowly fills back in, is a symptom that demands investigation. This kind of swelling, called pitting edema, can be an indicator of heart failure, kidney disease, liver disease, or severe venous insufficiency. Each of these conditions, left unaddressed, dramatically shortens lifespan and degrades quality of life in ways that are profound and often preventable if caught early. Heart failure in particular has a deeply uncomfortable relationship with foot and ankle swelling. When the heart is not pumping effectively, when its output is weakened, fluid begins to accumulate in the body's tissues because the reduced pumping force can no longer efficiently move fluid through the circulatory system. Gravity pulls that fluid downward, and it collects in the lowest point of the body, the ankles and feet. Many people who are walking around with early-stage heart failure are experiencing exactly this symptom: swollen ankles at the end of the day, shoes that feel tight by evening, socks that leave deep marks on their ankles, and they are attributing it to long days on their feet, to eating too much salt, to the heat. Sometimes those explanations are correct, but sometimes they are dangerously wrong. And the only way to know the difference is to pay attention, to notice patterns, to ask questions, to refuse to normalize symptoms that are your body's attempt to communicate something urgent. There is another category of warning signs in the feet that deserves serious attention, and these are the neurological ones, the signs that involve sensation rather than circulation, tingling, numbness, burning, or a feeling of pins and needles in the feet, particularly when these sensations are persistent and appear without obvious cause, are often among the earliest detectable signs of peripheral neuropathy. And peripheral neuropathy, damage to the peripheral nerves, is most commonly caused by diabetes and prediabetes, though it can also result from vitamin deficiencies, autoimmune conditions, and other metabolic disturbances. What makes this particularly alarming is that many people who develop neuropathy symptoms in their feet have no idea they have diabetes or prediabetes. The nerve damage appears before the diagnosis does. This is worth letting sink in. Your feet may be experiencing diabetic nerve damage before you have any official diagnosis of diabetes, before a doctor has told you that your blood sugar is a problem, before you've had any reason to believe your metabolic health is compromised. The nerves in your feet are sounding an alarm that could prompt you to get tested, to change your diet, to intervene early when intervention is most effective, and when the trajectory of the condition is still very much within your power to alter, but only if you're listening, only if you take persistent tingling or numbness in your feet seriously rather than assuming it will pass. There is also something deeply telling about the appearance of your toenails and the skin of your feet that most people never examine closely enough to notice. Thick, discolored, brittle toenails are often attributed to fungal infections, and sometimes they are exactly that. But chronically poor nail quality can also indicate systemic nutritional deficiencies, thyroid dysfunction, or circulatory compromise. The nails, like the hair and skin, are considered non-essential tissues by the body's triage system. When resources, blood flow, oxygen, nutrients, become scarce, the body redirects them toward vital organs and away from non-essential tissues first. So your nails begin to suffer before your organs do. They are, in a real biological sense, an early warning system built right into your body's surface. Dry, cracking skin on the heels and feet, particularly skin that doesn't respond to moisturizer, can similarly indicate thyroid dysfunction, as one of the hallmarks of hypothyroidism is severely dry skin that fails to retain moisture despite topical treatment. Hair loss on the legs is another sign that is almost universally overlooked, and yet it is one of the classic clinical indicators of peripheral arterial disease. When blood flow to the legs is compromised, the hair follicles on the lower legs, which require a steady supply of oxygenated blood to function, begin to die. The result is a patchy or complete absence of leg hair on the lower legs and feet, sometimes in a very specific visible pattern that stops abruptly at the point where blood flow becomes inadequate. If you look at your lower legs right now and notice that the hair is significantly thinner, patchier, or more absent than it once was, especially if you notice this asymmetrically with one leg more affected than the other, that is a conversation worth having with your doctor. Not because hair on your legs matters aesthetically, but because what its absence represents matters enormously. Now let's talk about your legs more broadly, specifically about muscle health in the legs, because this is an area where the connection between what you can observe and what it predicts about your longevity is perhaps the most striking and the most actionable. Muscle mass in the legs declines with age. This is a well-known process called sarcopenia, but the rate at which it declines and the degree to which it advances varies enormously between individuals, and that variation is not random. It is driven by lifestyle, by nutrition, by metabolic health, and by chronic inflammation. And the amount of muscle mass you have in your legs, specifically in your thighs and calves, is one of the strongest predictors of longevity that researchers have found. A large-scale study examining the relationship between leg muscle mass and mortality found that people with greater muscle mass in their lower extremities live significantly longer than those with less. And this relationship held true even after controlling for body weight, overall activity level, and other health factors. The reason is multifaceted. Muscle tissue is metabolically active. It burns glucose, it regulates insulin sensitivity, it produces anti-inflammatory compounds called myokines that protect the heart, brain, and immune system. Lean, strong legs are not just strong legs. They are metabolic organs. They are anti-aging organs. They are life-extending organs. And when they shrink, when muscle is lost faster than it should be, when legs become thin and weak and unsteady, what is being lost is far more than physical strength. The calf muscle, in particular, has earned a designation in cardiovascular medicine that most people are completely unaware of. It is sometimes called the second heart. The reason is anatomical and mechanical. Your heart pumps blood down to your legs through your arteries. Getting that blood back up against gravity from the furthest point in the body requires help. And the primary mechanism for that return journey is the contraction of the calf muscles. Every step you take, every time your calf contracts, it squeezes the veins in your lower leg and pushes blood upward toward the heart. This is why prolonged sitting is so cardiovascularly dangerous. It immobilizes the calf pump, allows blood to pool in the lower legs, increases the risk of clotting, and forces the heart to work harder without its primary assistant. The simple act of walking, not marathons, not intense exercise, just regular walking, is one of the most powerful cardiovascular interventions available to human beings, largely because of this calf pump mechanism. When the calf muscles weaken and shrink, as they do with prolonged inactivity, with aging, with poor nutrition, the efficiency of venous return decreases. Fluid pools, the heart is taxed. Varicose veins develop as the venous valves, under increased back pressure from pooled blood, begin to fail. And a chain of vascular deterioration begins that, over years and decades, significantly accelerates cardiovascular aging and increases the risk of serious events. This is why varicose veins, while often dismissed as a cosmetic problem, the province of compression stockings and vanity, are actually a window into venous health and should be evaluated seriously, particularly when they are accompanied by aching, heaviness, or swelling in the legs. Let's talk about balance and gait for a moment, about the way you walk and stand, because this is an area of research that has produced findings so striking that they have genuinely surprised the scientific community. The speed at which a person walks, measured over a short distance in a controlled setting, is one of the most powerful predictors of remaining lifespan that researchers have ever identified. This is not an anecdotal observation. It has been validated in enormous epidemiological studies involving hundreds of thousands of people across multiple continents. Walking speed integrates so many biological systems simultaneously: cardiovascular function, nervous system integrity, muscle strength, joint health, balance, coordination, that it functions as a kind of composite biomarker of overall health. When walking speed begins to slow, when steps become shorter, shuffling, uncertain, it is not just a symptom of aging. It is a predictor of how much more aging is coming and how quickly. Similarly, the ability to stand on one leg with eyes closed is something that researchers have found to be remarkably predictive of neurological and cardiovascular health. Try it right now if you're in a safe position to do so. Stand on one leg and close your eyes. Most healthy adults under 50 can hold this position for at least 10 seconds. If you cannot hold it for 10 seconds, if you feel unsteady, if your leg trembles, if you have to open your eyes immediately to catch your balance, that instability reflects something real about the state of your nervous system, your proprioception, and your brain's ability to integrate spatial information. None of those things exist in isolation. They are all connected to the same web of biological processes that determine how long and how well you live. And here is where it all begins to connect into something that should feel both sobering and genuinely, powerfully motivating. Because every single sign we've discussed, the cold feet, the leg pain with walking, the swelling, the tingling, the loss of leg hair, the shrinking muscle, the slowing gait, the failing balance, every one of these things sits on a spectrum. None of them is a verdict. None of them is a door slamming shut. They are, each of them, a message. A message from a body that is trying in the only language it has, sensation, appearance, function, to tell you that something needs attention, that something can be changed, that the trajectory you're on is not fixed. The research on vascular health is extraordinarily encouraging on this point. Arterial stiffness, one of the core mechanisms underlying peripheral arterial disease, heart disease, and cardiovascular aging, is not irreversible. Studies have shown that consistent aerobic exercise, particularly walking and cycling, can measurably improve arterial compliance, the elasticity and responsiveness of your blood vessels, within as little as 8 to 12 weeks. The endothelium, the thin layer of cells lining your blood vessels, is one of the most responsive tissues in the body. It responds to exercise, it responds to diet, it responds to the reduction of chronic stress, it responds to quitting smoking, it responds to better sleep. It is not passive, it is not fixed, it is alive, and it is listening to how you treat it. The peripheral nerves, similarly, have a capacity for regeneration that was underestimated for decades. When the metabolic insults that cause the damage, chronically high blood sugar, nutritional deficiencies, chronic inflammation, are addressed, peripheral nerves can and do regenerate. It is slow. It is not guaranteed to be complete. But it is real, and it is happening in people who take the early warning signs seriously and act on them while there is still time and biological capacity for repair. Muscle mass in the legs responds powerfully to resistance training at virtually any age. Studies involving people in their 70s, 80s, and even 90s have shown significant and meaningful increases in muscle mass and strength in response to progressive resistance exercise. Not just cosmetic improvement, functional improvement. Improvement in balance, in walking speed, in the ability to rise from a chair, in the independence and quality of daily life. The body retains its capacity for growth and adaptation far longer than most people believe. The mistake is assuming that decline is inevitable and therefore not worth fighting. it is worth fighting. The fight has a real and measurable return. So what does this all add up to practically? It adds up to this. Your feet and legs deserve your attention in a way that most of us have never given them. They deserve to be looked at, actually examined, the skin, the nails, the hair distribution, the color, the temperature. They deserve to be listened to. The aching, the tingling, the heaviness, the pain with walking. They deserve to be moved, walked on, exercised, challenged, consistently, and with the understanding that every step is not just locomotion, but medicine. And they deserve to be taken seriously when they speak up, rather than muffled with a painkiller or dismissed with the assumption that discomfort is just the price of getting older. Because the price of getting older doesn't have to be as high as most people pay. The gap between biological age and chronological age, between how old your body actually is and how many years you've been alive, is one of the most significant and actionable health variables that exists. And your feet and legs are one of the clearest windows into that gap. They show you honestly and without pretense what is happening in your arteries, your nerves, your muscles, and your metabolic systems. They show you when you're aging faster than you should be. And they show you when you start to make changes that those changes are working. The people who live longest and healthiest, who remain sharp and mobile and independent well into their 80s and 90s, share certain things in common. They move consistently. They eat in ways that protect their vascular health. They pay attention to early warning signs rather than waiting for crises. And they understand that the body is not a machine that simply wears out. It is a living system that responds to every choice you make every day in ways that accumulate over time into either resilience or decline. Your feet have been carrying you your entire life. Every step you have ever taken, every hill, every floor, every dance, every race, every ordinary Tuesday afternoon. They have never asked anything of you except to be noticed when they need to be listened to be taken seriously when they send a signal that something, somewhere in the complex and magnificent system they are connected to, needs attention. So here's the question I want you to sit with, and I genuinely want your answer in the comments below, because the people watching this deserve to hear from each other, and because your experience might be exactly what someone else needs to read today. When you think about the signs we've talked about, the cold feet, the leg fatigue with walking, the swelling, the tingling, the changes in your skin and nails and muscle, have you been experiencing any of these and dismissing them? And if so, what has been stopping you from taking them seriously? Because sometimes just naming the thing, just saying it out loud, is the first step toward doing something about it.